everyone, welcome to my channel, and in today's video we are going to discuss whiplash injury. So whiplash injury is basically an injury which happens in collision accidents like road traffic accidents or sports injury, where your body suddenly stops and your neck jolts forward and then backwards. Okay, so let's see how to take history from this patient, what examinations you need to perform, whether or not you need to request imaging studies, and what management can you provide this patient. Okay, so first of all, you need to introduce yourself and you need to confirm the patient details. And then you need to ask an open-ended question like, how may I help you today? Okay, so the most common presenting symptom for whiplash injury is going to be neck pain and neck stiffness. So as it is a pain symptom, we are going to start our history tracking with Socrates to explore the pain. So the site of the pain, the onset of the pain, was it sudden or was it gradual? And one important thing is to ask about the time of the injury and the time of the pain. Was the pain immediately after the accident happened, or was it delayed onset? Okay, this is important because if the pain was immediate onset, then it's going to be you're going to suspect a much more serious injury. Okay, then character of the pain, radiation, does the pain go anywhere? Sometime in whiplash injury, the pain can goes to the upper arms. Aggravating factor, relieving factor, severity of the pain on a scale of 1 to 10. Okay, and any treatment that the patient might have tried. Okay, then the next thing is, after exploring the pain, you need to explore circumstances of the injury. Okay, what type of collision? What type of collision basically happened? Was it a road traffic accident? Was it a sporting injury? Any safety factors? For example, was the patient in the driving seat? Was the patient in the front seat or in the back seat? Were they wearing seat belt? Okay, if there were no safety factors, the patient was the one who was driving or was in the front seat, then of course the impact is going to be much more severe than if they were in the back seat. And if they were not wearing seat belt, then again the impact is going to be much worse. Okay, was there any loss of consciousness at all? And if there was loss of consciousness, then what was the duration of the blackout? Okay, what happened immediately after the blackout? How were they feeling? Did they vomit at all? Was there any recollection of the previous event, or was there some degree of amnesia? Okay, so these are the questions that you need to ask. And then you need to rule out some differentials and also ask question about complications of the injury. So as this patient is presenting with neck pain and neck stiffness, you must rule out meningitis as well. Okay, just because there was a history of collision, you cannot just say, oh, it cannot be meningitis, because meningitis is a huge red flag. So any patient with neck pain and neck stiffness, you need to rule out meningitis. So you should ask about any fever at all, and any headache at all. Now, headache can also happen with whiplash injury, but if the patient is having a fever and a headache and a neck pain, then of course you need to do investigations to rule out meningitis as well. So any fever and any headache, this is a must question. In this case, it's a red flag question. Then any previous injuries at all. So if there were previous injuries, then it means that the impact of this injury is going to be much more severe. Okay, and these questions are about complications basically. So any weakness in the arms and the legs. If there is any weakness after the injury, then it means that the spine is involved, the spinal cord is involved, and there are neurological sequelae. So the injury is much more severe and there is damage to the spinal cord. Any numbness or tingling, again, neurological question. Was the patient able to sit and walk normally after the injury, or has there been any changes? Are there any changes in the bowel and the bladder? Is there any incontinence or retention? Okay, any incontinence or retention? Any headache, any dizziness, any visual changes? So all these are questions of complication. Basically, you're trying to rule out a neurological injury. Okay. And then in past medical history, you need to ask questions to kind of understand whether there has been whether whether the vertebral column was already weak due to some disease process going on. If the vertebral column was already weak due to some disease of the spine or disease of the bone, then it means there is much more chance of a severe injury and spinal cord damage. Okay, so you need to ask questions about any diseases of the spine, for example, ankylosing spondylitis, any previous cancers with metastasis at all, any history of osteoporosis, okay? And then in meftosa, in medications, you must ask about any medications that can increase bone loss, for example, steroids, okay? Don't ask the patient, do you take any medication that increases the bone loss? Just ask about any medications that you can think of that can increase bone loss. Like for example, ask the patient, do you take any steroids at all? Okay. And then allergies, of course, family history is not important here. Um, you can ask if there was any else involved in the injury and how they are doing. Okay. And then the psychosocial history. Are they experiencing any stress or anxiety after the injury? And then occupational history is very important here. What is their occupation? What's their dominant hand? Are they able to, do their activities of daily living and their job after the injury, or has there been some impairment? Okay, and then lifestyle questions. If you have some time, you can ask lifestyle questions here: cigarette smoking, alcohol smoking, etc. Diet, exercise is not that important, but if you have time, you can ask. Then ideas, concerns, and expectation. Ask the patient, what do you think? What's the cause of your pain? Do you have any concerns? Do you have any expectations from us today? And then in examination, you must inspect the neck and palpate to reveal any tenderness. Okay, and then check the range of movement of the neck, of the arms, and the legs, and do a full neurological examination, basically to rule out any neurological abnormality. Extra cervical spine only if the patient is older than 65. If immediate onset neck pain after the event. So this is why it's really important to ask the patient what time did the pain start after the injury. So if it was immediate onset neck pain, then you need to do an extra cervical spine. And if the patient is older than 65, the patient history of spinal disease like ankylosing spondylitis or osteoporosis, if it was a driving or drowning accident, and of course if there is any focal neurological deficit, then you need to do an extra cervical spine. But if you are not sure whether or not you should go for the extra cervical spine, it would be more safe to request an X-ray than to not request any imaging. Okay. Now, management actually starts with addressing the patient ideas, concerns, and expectations, and then explaining the diagnosis to the patient. So you need to explain to the patient that whiplash injury is a type of injury which happens when your head suddenly jolt backwards and then forwards in a whip-like manner. And it causes some, strain on the neck muscles, and this is why you are experiencing neck pain and neck stiffness. Reassure the patient that symptoms are basically a normal reaction to the jolting of the head backward and forward. So these are basically a normal reaction to the strain, and they will gradually resolve over a few weeks. You should emphasize to the patient that it's really very important to keep moving. Otherwise, their full recovery will be delayed. So they need to keep moving and discourage bed rest and immobilization. For pain, prescribe simple analgesia like paracetamol. And if the pain is much more severe, then you can also prescribe paracetamol with codeine. Discourage immobilization, discourage the use of soft collars. You can also refer to the physiotherapist for some gentle exercises and review in a week time. Okay, so that was all about whiplash injury. I hope it was helpful. And I will see you soon with the next video.